Over the next few weeks, we will hear from members of the Nurse Staffing Task Force as they share recommendations and actions to tackle the nurse staffing crisis. My name is Nicole Anselm, and I will be your host for the series. I am a senior policy advisor within nursing programs at the American Nurses Association and co-facilitator of the Nurse Staffing Task Force. Today's session is titled Creating a Healthy and Supportive Work Environment and will be presented to you by Dr. Linda Cassidy and Dr. Sarah Delgado. This will be a 5-part interactive webinar series, which will feature content developed and presented by members of the Nurse Staffing Task Force. Our goal is to engage nurses in discussions around actionable steps they can take at any stage of their career to tackle the nurse staffing crisis. Actions identified will align with the 5 imperatives of the Nurse Staffing Task Force. You will earn 1.5 CNE credits for each session, for a total of 7.5 credits for the series. There will be 2 parts to each session: a presentation on one of the 5 task force imperatives, followed by participant discussions. In the first part of the session, the imperative is introduced and context is provided on how it relates to nurse staffing. This part of the session will be recorded and will be available on demand at nursingworld.org. After the presentation, we will engage in discussions focused on actions nurses and nurse leaders can take towards implementing the imperative. We encourage you to participate in these peer discussions. This is a space for discussions, so please feel free to be open and speak freely. In our first session of the series, Dr. Cassidy and Dr. Delgado will discuss steps nurses and nurse leaders can take to create healthy and supportive work environments for direct care nurses. This aligns with the first imperative of the Nurse Staffing Task Force: reform the work environment. The goal for today's session is to identify actionable steps towards organizational change that nurses and nurse leaders can take to support a healthy work environment. By the end of today's session, you will understand the intricate relationship between the healthy work environment and nurse staffing, and how nurse managers play a pivotal role in creating and sustaining healthy work settings. We will have identified actions healthcare team members can take to support healthy work environments. The session will feature recommendations and actions from both the Nurse Staffing Think Tank and Task Force. Before we begin, I would like to take a moment to acknowledge those who participated in the Nurse Staffing Task Force. Over the course of 9 months, a diverse group of subject matter experts met regularly to bring together their expertise and develop the 5 imperatives and associated recommendations, which we will cover throughout the series. To promote diversity of thought, this group of experts included frontline nurses, healthcare executives, nurse leaders, quality and safety experts, and others with expertise in patient care. For each session, we will be joined by members of the task force as they share with us their expertise on the imperative that must be addressed to tackle the nurse staffing crisis we currently face. And now to introduce today's speakers. Dr. Linda Cassidy is an advanced practice registered nurse who serves as the Strategic Advocacy Manager with the American Association of Critical Care Nurses. She coordinates the development, review, and validation of advocacy, policy, and liaison activities that impact acute and critical care nurses, patients, and their families. Dr. Cassidy is a nurse researcher whose doctoral research focused on studying the relationship between healthy work environments, patient outcomes, and nurse caring behaviors. She passionately supports healthy work environments as paramount in fostering high-quality outcomes for patients and nurses. Dr. Sarah Delgado is a clinical practice specialist with the American Association of Critical Care Nurses and works under the Strategic Advocacy Division. In addition to that, Dr. Delgado is a co-facilitator of the Nurse Staffing Task Force. Her clinical experience includes work in chronic disease management and palliative care. She previously taught acute care nursing at the University of Virginia and has co-edited books on acute and critical care nursing. With that, I will now turn it over to our first speaker, Dr. Delgado.
Thank you, Nicole. I was on mute. I guess we've gotten that out of the way, the still on mute on Zoom. So I'm going to start by talking about the Nurse Staffing Think Tank and the Nurse Staffing Task Force as a whole, the two bodies of work, and then we'll get into talking about healthy work environments specifically. So this first slide shows a table comparing the think tank and the task force. So the think tank launched in January of 2022, which was really the peak of the Omicron wave in the COVID-19 pandemic. So staffing was in crisis. And the charge to the think tank was to identify strategies we can implement right now to improve that crisis. So we asked for strategies that could be implemented over a year to a year and a half. We had a professional facilitator for that work, and she walked us through a process of voting on priorities, assembling small groups, working in small groups to identify recommendations and action steps to address those priorities. And then we came back together as a large group and achieved practical consensus on the work. The task force was a little different. The task force was actually agreed to prior to the think tank, and with the task force, we were looking at what are the long-term sustainable solutions to the ongoing challenges in staffing. We all know that staffing was a problem before COVID was a word, right? So this is really looking at what are the things that have been barriers to appropriate staffing over the long haul. We used a different process with the task force. We had a larger group, as Nicole described, it was a very diverse group. And we used a different process. We did a lot of large group discussion. We used between meeting surveys to sort of take the pulse of the group. We had an iterative process of developing work and then presenting it and refining it and moving forward. And the approach we took when we published the task force work was really a yes and approach. It was not practical consensus. All of the members of the task force did not agree with all of the actions in the task force document. Instead, that document represents the cumulative expertise of the group. So while we developed imperatives and recommendations similar to the think tank, in the task force, we identified actions to consider with the idea that users and readers would review the content and select the actions that best fit the context in which they work. The think tank mostly focuses on actions that can be taken at the unit, organization, or health system level. So it's really about where clinical practice takes place. For the most part, there's a few policy implications in the think tank. The task force had a much greater focus on policy, regulation, and payment structure. We talk about accountable entities in the think tank work, and then we talk about partners in the task force, because we know nurses aren't going to accomplish these things in silo. They're going to work with others. And these QR codes that are here and we're on the rotating slides will lead you to PDF files of the recommendations of each group. So this graphic gives you a different visual display of the recommendations or the priorities and imperatives that the two groups identified. You'll see for the nurse staffing think tank, 3 of the 6 priorities they identified were stress injury continuum, work schedule flexibility, and total compensation. And those elements really belong with the health system, the organization, and the unit. On the task force side, we identified imperatives toward regulatory efficiency, establishing staffing standards, and demonstrating the value of nursing. And those imperatives really lie more in the policy arena. 3 of the priorities or imperatives that we identified through this national work: healthy work environments, innovative care delivery models, and diversity, equity, and inclusion, involve both practice and policy elements. Of course, today we're going to focus on the healthy work environment piece. So this slide is to demonstrate that we have the American Nurses Association has created a worksheet to help organizations to implement the work of the think tank. It's actually a scoring tool, so it goes through all the action steps in the think tank document and allows you to score them so that you can identify gaps and create an action plan for implementing the think tank work. The next slide shows the executive summary of the task force work. So you'll see on the far left the 5 imperatives that we identified, and then in the middle are the recommendations for each of those imperatives. The full task force document includes those options for action, which provide ideas for implementing the recommendations. So we're going to start talking about healthy work environments specifically. I'm going to go through some definitions, describe the recommendations from the 2 bodies of work, and then I'm going to give you the key points that Linda and I see from the full body of work. She'll be chiming in to provide her expertise on the last 2 key points. So first, some operational definitions. The nurse staffing think tank, the small group that identified recommendations and actions for a healthy work environment, created this operational definition of a healthy work environment. So a healthy work environment is safe, healing, humane, and respectful of the rights, responsibilities, needs, and contributions of all people. And that includes patients, families, nurses, and all healthcare team members. In these environments, nurses and other team members can provide their optimal contribution, and patients and families can achieve the best possible outcomes. So that's to give you an idea of what a healthy work environment looks like. In the nurse staffing task force, we launched that work asking the group to come together around an operational definition of appropriate staffing. And we did achieve consensus on this definition. So the definition of appropriate staffing from the nurse staffing task force is a dynamic process that aligns the number of nurses, their workload, expertise, and resources with patient needs in order to achieve quality patient outcomes within a healthy work environment. So we felt that the connection between appropriate staffing and work environment was so integral that we included healthy work environments in the definition of appropriate staffing. This slide shows the recommendations from each body of work related to healthy work environments. So you'll see for the think tank, work environment was one place where we did provide some policy related actions. And those actions were to actually require organizations to assess the health of the work environment. So with routine assessment, that can drive action towards creating a healthier work environment. So that was one place where we went a little bit in the policy direction with the think tank. The think tank also had a priority around diversity, equity, and inclusion. And I encourage you to take a look at that work because the process described in there of inclusive excellence is a great process for really bringing diversity, equity, and inclusion principles into action. It has to do with addressing the strategic and operational functions of the organization through those lenses. The nurse staffing task force identified 3 recommendations toward developing healthy work environments. The first is to establish empowered committees inclusive of direct care nurses that have the authority to create and sustain flexible staffing approaches. And I want to mention one of the actions in that was to include clinical coverage so that direct care nurses can attend those committee meetings with full attention. The second recommendation of the task force was to implement safety management systems and programs that create a healthy work environment and support physical and psychological safety of core and contingent staff. We really wanted to call out that it's both core and contingent staff, which also includes travel nurses that need to be addressed when we look at the work environment. And finally, supporting the role of nurse leaders is crucial to creating and sustaining a healthy work environment. So when Linda and I put together all this work and to identify key points to emphasize with you here today, we identified 3. The first is that appropriate staffing is inextricably linked to the health of the work environment. The second is that creating and sustaining a healthy work environment requires deliberate effort. And the third is that leaders must seek to build and sustain healthy work environments, and they must have support in doing so. So I'm going to talk about that first key point, that link, and then I'm going to hand it off to Linda, who has a wealth of expertise in healthy work environments, and she's going to walk you through the second 2 key points. So the link between appropriate staffing and the health of the work environment really occurs in 2 fundamental ways. First is nurse retention. So we know when we have better nurse retention, we're going to have better staffing, and healthier work environments have better nurse retention. Key evidence related to this comes from our, comes from our healthy work environment study. That's the chart on the slide, in which nurses working in units that had implemented healthy work environment standards were less likely to report intent to leave. Only 26% of nurses in those units reported intent to leave. Nurses working in units that had not implemented healthy work environment standards, 52% reported intent to leave. So similar findings can be seen in the American Nurses Foundation Pulse on the Nation's Nurses Survey Series. So we know that work environments are closely related to intent to leave or to nurse retention. There's also a meta-analysis that demonstrates the correlation between staffing and nurse outcomes, such as job satisfaction and burnout. So that again speaks to how the work environment is tied to nurse staffing. And finally, anecdotally, if you're talking to a friend and they say, you know, where I work, I feel safe, I feel heard, I feel appreciated, you would encourage that person to stay in that job, and you would certainly expect them to stay. They say they plan to do so. So it's very clear that how you feel about the place that you work has an impact on your decision to stay there. The second path through which staffing is inextricably linked to the work environment is the perception of staffing. So one way to measure whether staffing is appropriate or not is to ask the nurses in the environment if staffing is appropriate. And I think that's a really sound measure. We have research to back it up. And we all know that appropriate staffing, my friend Monica Vanderzee from the Academy of Medical Surgical Nurses, she says appropriate staffing is kind of like rock and roll, right? You know it when you have it, but it's hard to define it. So really asking nurses, was staffing appropriate, is an accurate way to gauge whether it was or not. So again, in units that had implemented AACN's healthy work environment standards, 44% of nurses reported they had appropriate staffing most of the time. In units that had not implemented those standards, only 16% of nurses reported having appropriate staffing most of the time. So this is another way in which staffing and the health of the work environment are closely linked. We also know that increasing staffing, so having better staffing in a work environment that is not healthy, means that patient outcomes don't change. You don't have better patient outcomes. So it's not just the number of people providing care, but actually the context in which care is delivered that is crucial to having those best outcomes for patients. I'm now going to hand it off to Linda, and she's going to talk about those other 2 key points.
Thank you, Sarah, and hello, everybody. I'm going to start off with a moment of personal gratitude here because I'm coming to you from South Florida, and we have blue skies here because normally this time of day there'd be thunderstorms, and if that were the case, you'd see me presenting with a 45-pound dog in my lap. So So all is good, and I'm happy about that. Yeah, so Sarah was saying that I'm going to be carrying us through key points 2 and 3. And in key point 2, it is that the important piece here is that healthy work environments require deliberate action. They just don't magically appear. They don't mysteriously appear. It takes action. And then in key point 3, we'll be walking through a bit about the key role that leaders play in healthy work environments. Okay, so as Sarah was talking, she touched on some of the outcomes that we know are between healthy work environments and nurses and other members of the healthcare team. But I wanted to spend a moment to talk about the fact that, when we first started work in healthy work environments in 2001, ACN made it our largest advocacy priority to dedicate our resources to the health of the work environment. And at that time, we had to base a lot of our work on environmental scanning, what we were hearing from the community, and frankly, good old-fashioned common sense. But I'm really happy to report now that several decades later, we have strong evidence that healthy work environments are linked not only to better nurse and healthcare team outcomes, but they're also linked to patient outcomes and hospital outcomes. So for example, patients who are cared for in healthy work environments, they have less mortality, there's less failure to rescue, there's better in-hospital cardiac arrest survival, there's fewer hospital-acquired conditions, patients are better prepared for discharge, so therefore fewer readmissions, and nurses report that there are better quality of care in environments that are healthy. And then that leads us to the hospital outcomes. So of course, better quality outcomes means more money for the hospital because of more reimbursement. Better patient satisfaction, frankly, means more business. And then of course, better staff retention, there's less turnover, less cost, and better continuity of care. So it is so important to understand the why in this. And remember, I mentioned how several decades ago, there wasn't a lot of evidence supporting this link. Well, because of that, a lot of people believed that healthy work environments was really a soft issue. Well, I'm here to say that we have a lot of evidence, as I mentioned, so it is no longer a nice to have. Healthy work environments are a must-have, a have-to-have, and is evidence-based practice. So if you're not working on the health of your work environment, frankly, are you really doing evidence-based practice? Personally, I think not. So where do we begin in all this? Well, just like we would do if we were taking care of patients, we start with an assessment. So I'll be talking about some resources to help you with assessing the health of your work environment. And there's many out there, even more than what I'll be talking about today. So once you assess, then you take time to digest the information and then discuss it among the team. And that's where some of the jewels are in that discussion of results. Again, healthy work environments don't just happen. So it takes deliberate commitment and action. So you have to create a plan. And then to be able to carry out a plan, you need to have sufficient resources to help you execute it. So, and then you want to reassess periodically. This piece I cannot stress enough. It's never a one and done. You have to keep reassessing, and creating and sustaining healthy work environments is a journey. There is no finish line. It's an evolution. So it's extremely important that you celebrate successes along the way and helps keep the momentum going. So as I had mentioned, AACN's been working on this for quite a while. So we have many resources available to you. So in 2005, AACN released the AACN standards for establishing and sustaining healthy work environments. You can see the 6 standards in the circles on the right. And these standards are absolutely essential and foundational for creating healthy work environments. And they will also provide a framework for doing this work. We also have many blogs, videos, infographics, and more. We have a free assessment tool that's available to anyone who would like to use it. You can use the tool. It's on our website. We will analyze the data. You can download your results report, and that will help you get started on where to begin. And all of this is free of charge. And then you can learn more using that QR code or go to www.aacn.org. And our colleagues at ANA also have substantial resources to help us on this journey. They've done some tremendous work on the National Commission to address racism in nursing. I hope by now you've heard about their Healthy Nurse, Healthy Nation initiative. There are resources and papers about incivility, bullying, and workplace violence on the website. And they also have principles for nurse staffing and many more. So please go and visit their website. So just to wrap up, key point 2 about, healthy work environments just don't happen, and the importance of understanding the why. I've always said that I would love to put a big, huge tattoo across my chest that says healthy work environments, they are evidence-based practice, but I decided I hate needles. So I think I'll just go ahead and create a t-shirt and ask everybody to wear one as a reminder. So moving into key point 3, this is the leader's role in the work. And it was so interesting because the work of the task force, it moved from external work, regulatory and that sort of thing, or organizational level work, and then really drilled down to the importance of leaders in this process. And when I talk about leaders in general, I am referring to both formal leaders and also informal clinical leaders. And in the recommendations of both the think tank and the task force, the importance of leadership came through loud and clear. In the think tank, it was so important to the members that there be in the recommendations a bullet that there's regulatory support to help leaders justify the time and effort required to assess and reform the work environment, that there must be something that has teeth in it, whether it's a CMS regulation or something like that, that the health of the work environment must be assessed regularly. And then the task force has I'm only going to touch on a couple, but there's a wide variety of actions to consider in supporting our leaders. And our leaders are absolutely critical in this process. So part of the work that the task force did as we were moving through the importance of leadership is drilling down into the critical piece of frontline leaders. Now, that could be a unit leader, like a critical care unit, step down, med surg unit, a department, but anybody that is overseeing frontline staff. And the task force felt very strongly that this cannot happen. Healthy work environments cannot happen unless leaders get the appropriate education, coaching, and mentoring. And that there must be enforceable guidelines for managers to have an appropriate span of control. I know when I was a nurse manager, there were 130 people under my domain, and it's impossible to have a relationship with every member on a regular basis. There also, and this one is so near and dear to my heart, managers, all leaders need a respite from the job. There must be time where we can separate ourselves and refresh and rejuvenate. 24/7 accountability needs to go away, and there needs to be off time when people are not being texted, that we can really have time to refresh. Because if we don't take care of our leaders, how the heck do we expect them to take care of our staff? We need to eliminate tasks that a manager doesn't need to be doing. For example, it used to take me hours in the morning to put the time into Chronos and all that stuff. Do managers really need to be doing those types of task-oriented work? And then we need to build in ample time to allow for strategizing with staff. ACN does periodic surveys in the health of the work environment. And in our last survey, our national survey, we got compelling data about the difference between the perception of the health of the work environment between direct care nurses and managers. And there is a difference. So people need time to come together to discuss, what does a healthy work environment mean to us, and how are we going to make them happen and sustain them as we go forward. So with that, I'm going to turn it back over to Nicole, and she's going to tell us about the remainder of the session.
Thank you, Dr. Cassidy and Dr. Delgado, for your presentation today. Let's take a few moments now to give our presenters the opportunity to answer a few questions from the chat. I will ask that our chat monitors, if there are any questions, are there any questions that our presenters can address?
Hi, Nicole. We have answered most of the questions in the chat, but let's just see if there's anything added in the past couple minutes here. No, lots of great comments. For the most part, all of the questions as of now have been answered in the chat.
Okay.
Okay, so here are questions coming in. Thank you all. So it looks like, have we linked tangible financial outcomes to the work?
There is literature out there. I don't have it at my fingertips, but that does talk about the savings in, avoided detrimental outcomes, savings related to less 15 and 30-day readmissions and things like that.
Okay, thank you. We have another question here. Are the principles of nurse staffing representative of the newest membership assembly resolution?
So the membership resolution that I think that the question refers to is an ANA resolution, American Nurses Association membership resolution. The work of the task force was actually the not just ANA, but it was the result of 5 partners coming together and developing this external group with diverse expertise. So the task force did not come up with exactly the same proposed ideas as the membership assembly, because it was this sort of other body of work that was collaborative among different groups, with representatives from a wide variety of specialty nursing organizations and state nursing organizations as well. So I think you're referring to ratios, and where the task force document addressed ratios was in that setting standards imperative, which is going to be discussed at a later session, as Nicole said. And you'll find in there that there is among the actions to consider, there is a discussion of ratios in that section. I hope that answered the question.
Thank you. We do have a question from Rhonda. How do you balance staffing when you have a lot of new staff? Those above me require us to stick to our staffing matrix and don't allow additional staff, even though 90% of the staff on duty are new nurses. So the question was, how do you balance staffing when you have a lot of new staff?
Yeah, that is an excellent question and a very common concern today. We do have resources at ACN to address that. We're looking at strategies such as using technology, having an experienced nurse on virtually accessible to support the newer staff is one sort of innovative strategy for addressing that. We just put out a nurse story about a health system in Virginia that uses clinical mentors who are not part of the staffing numbers. They actually come from the health system and they round on the new nurses. So I encourage you, please check ACN staffing in acute and critical care website for more resources on that, because that is a really key problem and we have to get creative about how we're supporting our newer nurses. Linda, do you have other thoughts on that?
No, I think that you covered it very well, Sarah.
We do have more questions coming in the chat. One is from Katie. How can we engage our interprofessional colleagues, such as physicians, in helping to create healthy workplace environments?
Yeah, it's typically, I don't know if it's because nurses have been the ones that have been driving this work over the last few decades. But now I think the conversation is and should be moving that it's about the team. It's interprofessional. So when the assessment is done, it, in my opinion, should not be reviewed with just nurses, because there's a whole team that takes care of the patients. So that's where the dialogue can really come forth of how we work together as team members. ACN's also getting ready to embark on a program that I think is very innovative and that is going to involve interprofessional team members in doing this work. And it will also involve triplets, 3 units working together in a particular trajectory of patient care or a continuum of care. And that's what we'll be focusing on. How do people work together? How does implementing the healthy work environment standards make a difference in patient or nurse healthcare team outcomes? And we'll be using implementation science to do that. So you'll be hearing more about that. It will be a 2-year initiative. And we'll be releasing information in probably the next 2 or 3 months on that.
Thank you. We'll try to just get to 2 more questions here before we move on. One is, were academic partners involved in either the think tank or the task force work?
We had nurse researchers, nurse scientists, and folks who had academic appointments in the task force, and I think one in the think tank, but we did not address the nursing pipeline because we knew that the American Association of Colleges of Nursing is doing work on the nursing pipeline. So though we knew that that was a priority, We didn't feel that we had assembled the task force with the plan of addressing that. So we did have some representation from academia, but we felt that the ongoing work by the American Association of Colleges of Nursing to address pipeline should continue before we make recommendations on that. So we kind of put that issue in a parking lot, if that makes sense.
Thank you. One last question here from Catherine. How do we hold on to our experienced staff and make them feel valued within the organization? The average year of experience has fallen dramatically, or the average years of experience has fallen dramatically.
Yeah, that's where this work is so important. In ACN's research, we've seen that if folks just start working on any element of the health of the work environment, like any one of the standards, we start to see improvements in things like meaningful recognition and in other standards. So retention, you know, as Sarah said, units with healthier work environments retain their nurses. You know, people like the rock and roll example that Sarah says, with appropriate staffing, the same holds true with healthy work environments. It's a hard thing to articulate, but you sure do know when you don't have it. And that's probably one of the major reasons that people leave organizations. So if you want to hold on to your nurses, follow the evidence and, you know, start working on this thing in a very deliberate way. People don't leave places that they love to work at.
Thank you. And we still have questions coming in. We're going to actually work on answering these questions via the chat. For now, we'll go ahead and turn it over to you, Nicole.
We will now share one key takeaway from each group.
I'm Carol Bickford from Group 1, and our reporter is going to be Beverly Jackson.
Okay, how do healthcare team members contribute to a healthy work environment? Share specific action you have taken or observed from a coworker. And we had very good discussion with that, and it all trickled down to teamwork. If that's no more than just helping with a bed, transporting a bed to a different unit, when a patient come in, everybody get together and do what they do best. One of the speakers in our group indicated that she didn't like putting NG tubes down. So her coworkers helped her in that aspect to help with that teamwork task that she didn't particularly like to do because she's had it done on herself. So that it all boiled down to teamwork, and the specific action as to how did the nurse leaders come up with these different ideas. A lot of it was from getting together with other managers, getting ideas on what they should do in the unit. A lot of it was brought up from the chain of command, dealing with the CEOs, CCOs, and then trickling down to the nurse managers, and they passed it on to the unit. So, but the majority of it was teamwork, and it almost trickled into the next question with the nurse manager, but it's saying that with nurse managers, they have to have the same mindset that, you know, it's teamwork, and they have to work accordingly because they are the role models for the unit.
Thanks, Beverly.
You're welcome.
Hi, I'm Joellen Schimmels. I am the spokesperson for Group 2, and we had a lot of really great discussion, but some of the things that we all agreed on is that we're looking forward to really using this evidence, what we learned from here to take back to our organizations. A lot of what we talked about was about how we involve, different professions and really use that interdisciplinary approach. A lot of times at nursing seems like we push a lot of these things, but we don't always get other people involved. And then it seems like when things fall flat, it's kind of hard to keep the momentum going. We also talked about really a lot about belonging and how do we help people feel like they are part of the team, part of the family. That's a number of different ways, not just additionally working that interdisciplinary, but how do we support one another? How do we not make people feel dumb? How do we help keep our doors open where we can, instead of talking badly about people, that we really are able to have people who we support, that they can come to us, that we can be very open to giving and getting feedback, and then really supporting as informal leaders, and the importance of having the front line involved. That's something that we talked quite a bit about, but we had mentioned collaboration, safety, supporting one another, inclusivity, empowering one another, and transparency. Thanks.
Thank you, Joellen.
I think
I'll
I'm
go next.
number
Okay, go ahead,
three.
Leslie.
Oh, okay. I really didn't know what group number I am, but I think I'm number 3. So I'm Leslie Kelly. I'm the nurse scholar in residence for the task force. And I had a wonderful group. We were a little more informal in talking about the questions, but a couple themes came up. We really talked a lot about leaders and their role in the healthy work environment, and some really great exemplars came out from our organizations represented, and some concerns about how they are in the healthy work environment, but some opportunities as well. Some shared how they practice a healthy work environment with having their leaders take time to recover. Gregory shared with us that he has some great practices where if he's covering a manager, he doesn't want to hear from them, doesn't want to hear their voice, doesn't want to see them. So making sure that PTO truly means PTO. And we talked about how that's a lost opportunity and we don't often see that. Also things like the burden of meetings and how that's really a problem. And we could do things like, say, not having 2 levels of leadership in the same meeting. And then following up on that, how to make sure that communication happens and making sure that we have a strong, healthy work environment for having professional reliability and making sure those managers are communicating with each other. The other thing that really came out as a strong component of the healthy work environment related to leaders, but also in general, was meaningful recognition. So some strong examples of how to recognize colleagues electronically, through recognition systems, a really cool idea where you could reward recognition hours of time off, tokens, things like a currency that you can buy things with, cheers programs, gratitude opportunities, things that don't always take a lot of workload or a lot of heavy lifting, but means so much to others. And obviously that's near and dear to my heart because that's where my research is. And so really good to see that that's coming out. So lots of other stuff came up in our group, but those were 2 big, strong takeaways.
Thank you, Leslie. I guess I'll go next. And I'm going to ask my friend, Dr. Valerie Morrison, to do the report out for our group.
Thank you, Katie. So our group, one of the last things that we really were talking about was how to support the nurse managers, because it's so crucial in creating and maintaining a healthy work environment. And we had great discussion regarding the necessity for ongoing mentoring and coaching of nurse managers, and not just when there's a problem, but creating that succession planning and offering it to them prior to them going into the role, and not just selecting individuals because of their, perhaps identifying individuals because of their clinical skill set and their work ethic to go into leadership, but then also to ensure that you're preparing them so that they know how to handle how to assume that role. And one great key point that was brought forward had to do with the leadership training that they get really needs to be focused not just around task-oriented issues. It seems like we're really good about that, how to do this paperwork, how to make sure, you know how to hire and or let go of people and all those different tasks as a manager. But that higher critical thinking skills, how do we ensure that we are bringing that into the leadership development in order to really develop those nurse managers, make them confident in their roles and succeed.
Thank you, Dr. Morrison. I guess I'll turn it back over to where's she? Nicole. I know you didn't get to go, so for your group.
So my group, we identified some common themes that were evident in the responses. A lot of the discussion focused around creating a culture of caring and creating an environment of safety, especially psychological safety. In addition to that, we identified that, especially with nurse managers, they can build trust with their staff. That includes addressing issues early on before they become a problem, not letting problems fester and become worse over time. In addition to that, also adopting a zero tolerance for nurse bullying. We talked about how with nurse bullying, when new nurses are criticized, it creates an unsafe environment for the nurses to learn, and the nurses are then unable to learn. So with that, we will skip a few slides and move into our session wrap up. So thank you everyone for sharing your key discussion takeaways. As we wrap up today's session, there's just a few reminders I would like to share with you all before we end for today. First, don't forget to claim your CNE credits by completing the evaluation form. The link to access this form will be placed in the chat. You will earn 1.5 credits for today's session, and as a reminder, you can earn an additional 6 credits by attending our next 4 sessions. I would like to thank our presenters, Dr. Cassidy and Dr. Delgado, for their presentation on reforming the work environment. On September 21st, we'll be joined by Task Force Scholar in Residence, Dr. Leslie Kelly, and Task Force member, Dr. Vicki Good, for the second installment of the Project Echo series, titled Transforming Cost and Value, Recognizing Nurses' Unique Contribution. This session will focus on how nurses can advocate for the development of approaches that quantify the impact nurses have on organizational performance and outcomes. I would like to thank everyone for joining our session today. We hope that you enjoyed your time with us, and we look forward to having you with us again for our second session. And the QR codes are posted on the slides, so you can access the think tank and task force recommendations.
Thank you so much. Thank you for letting me know. Okay, I'm gonna see if I can do that.